Welcome to this CPD course, ECG Made Simple, Pediatric and Adolescent Chest Pain and Palpitations. This course is designed to help clinicians confidently interpret ECGs in young people, with a focus on chest pain and palpitations, two of the most common but often confusing presentations in pediatric and adolescent care. Over the next 2 hours, we'll work through practical cases, structured workflows, and red flag recognition to support safe decision-making. Who should take this course? This course is ideal for healthcare professionals who regularly assess young people with chest pain or palpitations. It is tailored to general practitioners, pediatricians, emergency department staff, nurse practitioners, paramedics, and rural health workers. Clinical educators will also find it useful for teaching ECG interpretation to medical and nursing students. Why this course matters. Chest pain and palpitations in young people are common, but the majority are benign. However, a small percentage represent life-threatening cardiac conditions, such as supraventricular tachycardia, Wolff-Parkinson-White syndrome, myocarditis, or hypertrophic cardiomyopathy. The challenge lies in separating the benign from the dangerous. Misinterpreting ECGs by applying adult rules to children is a common pitfall. This course provides a structured, practical approach so that serious cases are not missed and benign cases are not over-investigated. Module 1. Why pediatric ECGs differ from adults. In this module, we'll examine why pediatric ECGs cannot be read the same way as adult ECGs. Children's hearts have unique patterns due to right heart dominance at birth and gradual developmental changes through adolescence. For example, T-wave inversions that would be abnormal in an adult may be completely normal in a 10-year-old. We'll explore these differences step by step, ensuring you know what is normal at each developmental stage. Module 2. Structured Approach to Pediatric ECG Interpretation. Here we'll build a systematic framework for reading ECGs in young patients. We'll cover correct lead choice, measuring intervals, and recognizing normal variants like T-wave inversion or R-wave dominance. We'll also discuss common pitfalls, for example, overdiagnosing left ventricular hypertrophy or misinterpreting QTC. By applying this structure consistently, you'll improve accuracy and know when a cardiology referral is needed. Module 3. Chest pain and palpitations in youth, benign versus pathological. Most pediatric chest pain cases, over 98%, are non-cardiac in origin. Causes include musculoskeletal strain, respiratory conditions, reflux, or anxiety. However, there are red flags that should trigger escalation: exertional chest pain, syncope, family history of sudden death, or abnormal ECG findings. We'll also look at how to distinguish benign palpitations from supraventricular tachycardia and when an ECG is essential. Module 4. Recognizing specific arrhythmias in adolescence. This module takes a closer look at arrhythmias seen in adolescence. We'll cover how to spot SVT on an ECG and how WPW patterns differ from normal conduction. We'll also explore QT prolongation, torsades de pointes risk, and the red flags for hypertrophic cardiomyopathy. Finally, we'll review ECG features of myocarditis and pericarditis, two important but often missed conditions in youth. Module 5. ECG Auto-Interpretation, Why You Can't Rely on It. Automated ECG interpretation can be a helpful tool, but in pediatrics, it has major limitations. Voltage criteria, QTC calculations and rhythm interpretations are often inaccurate in children. Case studies show how auto reads can either overcall disease, leading to unnecessary referrals, or miss serious conditions altogether. That's why manual review, combined with clinical context, remains essential for safe care. Module 6, Clinical Scenarios and Case Discussions. Now we'll bring everything together with real-world cases. Case 1. A 14-year-old with chest pain after sport. How do we decide if it's benign or cardiac? Case 2. A 16-year-old with palpitations. How do we differentiate SVT from anxiety? Case 3. A 12-year-old with syncope. Could this be Wolff-Parkinson-White or just a normal variant? By working through these scenarios, you'll apply structured workflows and know when to escalate. Learning outcomes. By the end of this course, you will be able to explain how pediatric ECGs differ from adult ECGs, follow a structured workflow for safe interpretation, identify common arrhythmias such as supraventricular tachycardia, Wolff-Parkinson-White syndrome, and QT prolongation, distinguish benign chest pain from cardiac red flags, recognize the limitations of auto-interpretation, and apply clinical judgment. These skills will enhance your confidence in managing chest pain and palpitations in children and adolescents. CPD Course Assessment. At the end of this course, you'll complete a short assessment. It will test your knowledge of pediatric versus adult ECG differences, structured interpretation steps, recognition of red flags, identification of arrhythmias, and the pitfalls of auto-interpretation. This ensures you can apply the course learning in practice. Certificate and CPD credit. On completion of this course and successful assessment, you'll receive a digital certificate of completion. This confirms 2 CPD hours in pediatric and adolescent ECG interpretation. This certificate can be used towards your professional development portfolio and revalidation requirements.